Welcome to Living Fuel TV. I'm Casey Craichy with special guest Dr. Leonard Smith. Welcome back, Leonard.
Thank you, Casey. I'm glad I could be back.
It's always great to have you. Heart disease is a big issue. It's one of the leading causes of death in the United States. And I would say preventable death.
That's true. It is preventable.
So people walk around and they're in fear oftentimes because it runs in their family,
right,
or they're getting older and whatever the case may be. And heart attacks are largely preventable. Let's talk about that.
Okay, well, everybody sees this on the news. It's definitely quit smoking. Alcohol, again, if it's maybe one glass of wine, it's okay. I question going even to 2, but certainly 2 is a cutoff for most medical literature. But certainly excess alcohol can really hurt the heart. But then the really big one is diet. You know, the Western diet, too much saturated fat, too much meat, too much sugar, too much processed foods, too many trans fats, not enough of your omega-3 balanced, the right balance with omega-6, the good fats, probably not enough hydration, I mentioned not enough exercise, and then I think a big one is just psycho-emotional stress, which I think people need to work on all parts of that, but it's really pretty simple.
So everything you said is diet and lifestyle. Everything you said regards to choice.
Exactly, it's diet and lifestyle.
You know, so right now, if someone is concerned about having a heart attack, they're overweight, they don't really feel like exercising, or they've already had a heart attack and they're trying to get their life right.
Right.
You know, there are certain things that people need to do. One thing I always tell people to do is to take everything that the doctor takes or that tells you not to take prior to surgery.
Right.
Okay?
Right.
Anything the doctor tells you not to take prior to surgery is what you need to be taking to keep from having surgery. Like the omega-3s and the vitamin E's and the vitamin A and the D's and the ginkgo and all, exactly, all these herbs and so forth.
Well,
keep
because the reason, you know, obviously why it is, that those optimize blood flow. And since you can't be really sure if you optimized or if you a little bit overdone it and somebody's cutting into you, you don't want to have overdone it with your omega-3 and E and garlic and whatnot, because you really could get into bleeding problems.
Yeah, I don't want to suggest the doctor is not right to tell you not to take these things within 7 days, because they are. But obviously, medicine recognizes the power of these nutrients.
Right,
okay,
absolutely.
Or they wouldn't every single hospital on the planet tell you within 7 days don't take any vitamins, minerals, herbs, whatever. In fact, I just saw a study come out yesterday that showed that a common multivitamin reduces the risk of heart attack by 40%.
Right.
You know, so we know that things work. We know omega-3 fish oil. I mean, you know, so we got a couple situations. So now someone's totally healthy, and they're gonna say, "Wow, I get that. I'm gonna start taking my, broad spectrum fat soluble antioxidants and omega-3s and so on." It's going to be a very positive thing for them, because they're going to reduce the risk of heart attack by a dramatic amount.
I think so. I really do.
And then if they've already had the heart attack and then they're recovering and they start to do this, they're going to recover better and reduce the risk of a secondary occurrence of heart attack. Right. So many people get on this Plavix or Coumadin or something like that, and so many people want to get off that stuff.
Right.
And because aspirin, Plavix, Coumadin speak to this, but these are irreversible platelet aggregation. That means if one cuts themselves, it's really going to be a hard time stopping the bleeding. But interestingly, the natural things like the omega-3s and the vitamin E's and so on, that's reversible platelet aggregation, and that means if they cut themselves, it's going to reasonably stop bleeding within a reasonable period of time. So tell me, so if someone's taking fish oil and Plavix, since they're getting their levels checked, fibrinogen levels checked every 2 weeks or a month?
It depends on the doctor, but at least I would think every 1 or 2 months.
So can they slowly elevate their fish oil and then keep checking and then have the doctor?
I think that's an excellent idea, but they will really need to work with a doctor that has the time to understand that, because the saddest thing for me is to see people get on Coumadin and then they're told they can't eat green leafy vegetables because the vitamin K is the way to reverse the Coumadin. And so it's unfortunate. I think it's good. The platelet ones I think you can work with a little easier in terms of the diet, but it's just a shame if you have to cut out some of the best nutrients we have because of the drugs. And I'm not telling people to go nutrients without the drugs, but if you can, I used to work with patients with it all the time.
A lot of doctors do. In fact, I know a lot of doctors that will tell you, you got to have vitamin K or you're going to have another heart attack. I mean, there's a reason to have vitamin K in your system. There's a whole lot of things it does. You have to have all these nutrients. So what they say is, go ahead and take your broad spectrum nutrients, and we'll offset it with the Plavix or the Coumadin. And then as we increase the fish oils, we're going to check levels as time goes on, and hopefully at some point take you off the Plavix or Coumadin and leave you on the natural stuff. So you know, taking broad spectrum antioxidants and all these nutrients is critically important for health. We know that for a number of reasons, right? And we saw something recently on Resveratrol, right, with the angiogenesis.
Right. That, along with almost every berry, and most fruits and some vegetables you could mention. And what they do is so beautiful. They balance angiogenesis. And like if you're worried about a cancer, you don't want angiogenesis. If you're worried about a heart attack, you do want angiogenesis. Right. But if you eat the right food, it balances it. Right,
exactly.
That's the real key.
Fascinating. Leonard, it's always a pleasure.
Thank you.
Hope you enjoyed it. God bless you, and have a great day.